just as there are sinoatrial and atrioventricular blocks, there is also something known as intraatrial block and interatrial block. These are less well-known entities which can be recognized electrocardiographically. And finally, there is something known as Bayes syndrome, which can occur as a sequelae of interatrial conduction block. This is the normal P wave in inferior leads. When it is wide and notched, it can be partial interatrial block if there is no evidence of left atrial enlargement on imaging studies. That is P mitral like morphology without associated left atrial enlargement on imaging studies. Occasionally, this can also be associated with left atrial enlargement. Then differentiation will be difficult. In advanced type of interatrial block, there are wide biphasic P waves. That is how it is represented. This is the diagrammatic representation of intraatrial conduction system. There are three pathways between sinus node and AV node. They are the Wengi-Back, Thorel and Bachmann's. A part of Bachmann's bundle also reaches the left atrium through the roof of the atria. It's occurring in the upper part. This is Bachmann's bundle. Bachmann's bundle is also used for pacing. Bachmann's bundle pacing. If it is done in this region, there is synchrony between the two atria. P waves will be narrower than in normal case. So this is the anatomy of the interatrial and intraatrial conduction system. This is not well known usually, and these are not as well defined as the intraventricular conduction system like the His bundle and the bundle branches and fascicles. Now we will review the classification of interatrial block. First degree interatrial block, P wave duration more than 120 milliseconds that we have seen in the previous diagram. Third degree interatrial block, longer P wave duration with biphasic P waves in inferior leads. Second half is negative, that also we have seen in the diagram. Then third degree interatrial block, these abnormalities are seen transiently in same ECG and is known as atrial aberrancy. This is almost similar